Processed meats such as bacon, sausages, hot dogs, salami, ham, and deli meats deserve particular caution for anyone concerned about gout, high uric acid, or broader metabolic health. While they are often marketed as convenient protein sources, they combine several risk factors that work together to worsen urate balance and inflammation. Many processed meats contain moderate to high levels of purines, especially when made from mixed cuts, organ remnants, or mechanically separated meat. These purines contribute directly to uric acid production, and when consumed regularly, they can raise baseline urate levels, increasing the likelihood of gout flares even if portions seem modest. Beyond purines, the processing itself introduces additional problems. Processed meats are typically high in saturated fat, which is strongly associated with insulin resistance. Insulin resistance reduces the kidney's ability to excrete uric acid efficiently, meaning that even normal purine intake can lead to higher blood urate in susceptible individuals. This creates a compounding effect. Purines increase uric acid production, while metabolic dysfunction decreases its clearance. Over time, this combination can make gout more frequent, more severe, and harder to control with diet or medication alone. Sodium content is another major concern. Bacon, sausages, and deli meats are often extremely high in salt, which can worsen hypertension and kidney stress. Since the kidneys play a central role in uric acid excretion, anything that impairs renal function indirectly worsens gout risk. High sodium intake can also promote dehydration at the cellular level, especially when processed meats are eaten without adequate fluid intake, further concentrating uric acid in the blood and joints. Preservatives used in processed meats, such as nitrates and nitrites, may also contribute to systemic inflammation and oxidative stress. Chronic low-grade inflammation is increasingly recognized as a background driver of gout, even between acute attacks. Diets high in processed meats are consistently associated with higher risks of cardiovascular disease, type 2 diabetes, and obesity, all conditions that commonly coexist with gout and amplify its severity. In this sense, processed meats do not just trigger gout directly, they worsen the entire metabolic environment in which gout thrives. Another practical issue is portion creep and frequency. Processed meats are easy to overconsume because they are calorie-dense, highly palatable, and often eaten daily as breakfast foods or sandwich fillers. A few slices of bacon here, a hot dog there, or deli meat at lunch may not seem excessive, but over a week these foods can contribute a steady, repeated uric acid load that keeps levels chronically elevated. Unlike whole cuts of meat that are eaten as deliberate meals, processed meats often slip into the diet unnoticed, making control more difficult. From a nutritional standpoint, while processed meats do provide protein and some B vitamins, these benefits are outweighed by their risks for gout-prone individuals. The same nutrients can be obtained more safely from lean, unprocessed meats, eggs, low-fat dairy, legumes, tofu, or carefully chosen fish with lower purine content. These alternatives support muscle maintenance and satiety without the added burden of preservatives, excess sodium, and metabolic disruption. In practical terms, people with gout, elevated uric acid, or frequent joint pain should strongly limit or avoid processed meats altogether. They are particularly risky during active gout flares, periods of stress, illness, dehydration, or alcohol consumption when uric acid control is already compromised. If consumed at all, they should be rare, small, and not a daily habit. Shifting away from processed meats is not just about avoiding a trigger food, it is a broader strategy to reduce inflammation, protect kidney function, and improve long-term metabolic stability, all of which are critical for keeping gout under control.